Thank you so much, Pete. And I'm so glad to be here, although remotely only. And apologies, it's really only because I wanted to visit my parents. And this was my chance to do so on the back of the talk I was giving this morning. I would have really liked to be at the conference today. I realize it's the end of a long and intense day and the program is great, so you're probably all quite tired. So I'll try and be concise. And my role today, as I think, is really just to suggest fruitful thoughts for discussions that probably will not finish today, but hopefully will initiate today if they haven't already. So I'm going to be talking about this idea of connecting all the work that has been happening on Fragile X at the family level, at the researchers level, at the clinical level, at the educational level across the UK, much of which has really been driven by what the Fragile X Society has done for many, many years. More and more, I think we all agree, researchers, clinicians, parents, young people with Fragile X, that every family with Fragile X should be able to access, either locally or semi-locally, the care pathways that are appropriate for them and their family members, no matter what nation in the UK they live, no matter what NHS trust they're immediately served by or local education authority. This is just a right. That should happen. But how do we do that? How can we make that happen, given that, as I'm sure you've been discussing all day, and in fact even in a session on care pathways with Kirsten, Haley, and Andrew, actually there isn't a preset, even recommendation care pathway that we can use to advise families, and we really need one. Despite the fact that diagnoses have been known for a long time. So how can we get there? I was really pleased and so happy to hear that you had a brainstorming earlier today on generating at least a guideline document on care pathways for Fragile X families. And looking forward to hearing what you discussed as soon as I get back. From the point of view of supporting those care pathways, there are already some great examples of successes in the UK, and we're lucky in that sense that there are centres of excellence and networks that have already been successful. I'm sure you're familiar and you remember, in fact, and Andy has been speaking about the work in Edinburgh and in Scotland more broadly, the Patrick Wild Centre has generated. An observation as an external observer of the Patrick Wild Centre is that, to me, it has an amazing strength and unique point of excellence, which is bringing together the clinical science element and a basic science partnership, so that really work together. And I hope, Andy, I'm not saying something wrong right here there, that this is really a strength of the centre. And equally, although more recently, but equally strong, is the Cerebral network that brings together Haley, but also her colleagues at Birmingham, Aston, and Surrey, with a different model. It's not a single location spread. It generated in Birmingham and was generated by Chris Oliver and his work, but really now it extends beyond Birmingham only, and has a different set of strengths and highlights. It focuses on multiple conditions, not on Fragile X only, and it particularly focuses on children and young people with limited expressive language. So individuals are often left out by many either research studies or care approaches because of their difficulties. So you see, these are already exist in the UK, and really we would like Patrick Wild Centres and Cerebral networks all over the UK, ideally one per nation or more, that could really continue to foster and support not only research, but also clinical and educational care for individuals with Fragile X and their families. How do we do this? It's a challenge, absolutely. In fact, the idea of networks and hubs raises many challenges. And just to highlight what a challenge is, I'm going to bring myself into one example of a failure. So I don't know if Andy and Amy have said, but we've been trying for a long time to find ways of supporting a network of researchers and with clinical interests, educational interests, that could be funded to do work across the UK. Actually, altogether, we brought collaborators who were not in Wales, so we couldn't find a Welsh partner, but extended to Scotland, and then had a number of hubs and locations within within England, in the north and the south as well. And we would have loved to think of a connection to Northern Ireland, but couldn't quite stretch it to that. In part because many of these funded opportunities are limited in the amount of connections that you can make, because an extra collaborator costs money to the grant. So really stupid logistical reasons why networks cannot be as large, or have not been as large as we might have wanted them to be. Now, sadly, we tried our best, and the Fragile Life Society wrote a fantastic letter of support, but we sadly weren't funded. And reflecting on failures is really important as an academic, because we fail a lot. So one of the reflections from the reviewers' comments and amongst ourselves at the end, where we still had a glass of wine and everything, was to think perhaps we were trying to make things, we were trying to put together the idea of a network, but not think enough about how we complemented each other. In fact, apart from Andy, who's the only psychiatrist in the team, everyone else was a psychologist. So in that sense, our centres and our expertise were highly overlapping. We weren't really proposing the idea of centres that complement each other and researchers that complement each other. Maybe that's one reason why this failed. Who knows? You never really work it out from grant applications. But we're still not giving up. And in fact, many people in the UK have raised this question of how we continue to pursue this idea of having networks and hubs, with local hubs being the places where families can access information, can feed as in influence research, so that the research that they're interested in gets done, and can draw from the findings themselves. How do we support these kind of hubs? Lots of ideas have come up independently, and now we're maybe talking to each other as well. For example, a little while ago, pre-pandemic, in fact, Kirsten knocked on my door many times and said, we both live in Oxford, why are we not rallying together the people who are around us? Either already Fragile X experts or could be interested and enticed to be. So in 2018, I can't remember when the first one was, but we had a meeting of local potential interested enthusiasts, and we adopted Haley, who wasn't actually living in Oxford but came anyway. So this was an attempt to bring together local expertise and think of brainstorming on how we could extend our work together. And I know, in fact, from Chris, who's in the audience, Chris McQuaid and Alex McQuaid, who's in the audience, that a very similar effort in the sense of bringing together local expertise to develop a centre of excellence is something that is ongoing at Leicester and has begun. So if you in the audience live in Leicestershire or in Oxfordshire, please go and see my friends and colleagues in the audience. The model for these local hubs may be really different depending on where you are. So in Oxford, Kirsten and I have explored philanthropic donors. We've thought about, we've discussed ideas of that kind. We continue to brainstorm, and maybe models that are different work differently in your own local reality. But one thing, and point for discussion, food for thought, is that it is a real challenge to fund centers of excellence that do exactly the same thing. So in that, we don't have enough experts across the UK that we could allocate to individual centers of excellence. Perhaps we can connect them, and perhaps we can leverage remote and online methods of consultations. But this system is a stretched one, that of having one expert in one area that we're really interested in, per area that we're really interested in Fragile X at each local hub, is not a trivial one to implement. So perhaps we shouldn't forget the idea that networking is also across experts, and I know that the Fragile X Society does this a lot, for example, trying to find researchers and clinicians other than some of those celebrities who are interested or might get interested in fact studies, so that we can connect them. And I don't know, Kirsten, if you want to say more about that, but that's a possibility for the future, is connecting experts across the country. For discussion, and I'll stop talking, and really, I'd love to hear what you think, and I mean, there are many people in the audience who can answer questions better than I can. I guess there are at least two models, and maybe more, that are worth considering, discussing, and maybe both or none of them are appropriate to your local reality. On the one hand, we've seen at various presentations, either invited by the Fragile X Society or elsewhere, you may have seen that the equivalent hubs have existed in the US, for example, in other countries that have been called Fragile X research clinics. That is a really interesting model because maybe that is a model that encompasses that idea of multiple individual experts coming together to advise families as they receive a diagnosis. Sadly, the funding model, the way in which research clinics works in the US, is rather dependent on how the National Health Service or its not existence in the US works. So that the differences are really interesting and striking in how those models become feasible. That's not to say that a system like that couldn't operate in the UK, and I believe in the Patrick Wild Centre, in fact, acts in some sense as a research clinic, not quite in the same way as the North American ones, but it isn't impossible to think of something like that established in the UK as well. However, there are limitations and big differences in how the funding models work to make such a thing sustainable over the long term. Could we also explore the idea that research clinics that do exactly the same don't necessarily offer something new and complementary to each other? So that maybe we should at least think about how centres of excellence across the UK could differ and complement each other. For example, would a centre that focuses on women with Fragile X complement all the work that has been done on autism related and symptoms in Fragile X, or on a focus on children and young people who are less verbal, or are there other needs that are quite unique within the Fragile X community but could become expertise of complementary centres of excellence? So that's at least to me it seemed like two non-mutually exclusive, maybe initial models to think about, and there I'm sure are more that I've forgotten about. So that's all I had to say, really. And Kirsten, I think you particularly wanted me to keep it general. So in that, I don't have, sadly, I don't have more funding to offer, but there are cases of success already in the audience, and anything in the future should be informed by what families want. So I'd love to hear what your reflections on what I said are. So I'll stop here and stop sharing. There you go.